who's such a wonderful champion on children's healthcare issues and community health centers. So we're appreciative that you're here. And, you know, the families that are here, the kids and families across Michigan and the country should be spending time getting ready for the holidays. Come on up. Come on up and join us. Hi. It's good to see you.
Hello.
It's good to see you again. Hi. So, you know, the family's here, and Senator Casey's coming in to join us. We know this is a special time in the holidays, and people should be celebrating instead of worrying about whether or not their children will be able to see their doctor next year, or whether or not they themselves will be able to have the health care that they are currently receiving through community health clinics. It is 74 days. As you know, I've been going to the floor every week. We're counting the number of days since the funding stopped in September 30th, and there's no excuse for this to have occurred. Yesterday, the policy committee, which I chair, released a state-by-state report on how Congress' failure to act is hurting families. We will hear from people that are with us today. This is also an issue of jobs. If people are losing their doctor, health centers are having to close, that's also jobs in communities across Michigan and the country. 9 million children of working families are getting health care today because of something that has traditionally been a bipartisan program called the Children's Health Insurance Program. Thanks to CHIP and the other efforts that we've worked on to provide affordable health care, 95% of the children in our country today have health insurance and have access to a doctor. In fact, it's even a little higher in Michigan. It's 97%. But this month, we are already seeing programs and funding being cut off. Arizona, New Hampshire, Oregon are losing funding this month. In January, we will see more. In February, more, including Hawaii, which I know Senator Hirono is deeply concerned about, and Pennsylvania, where my colleague and friend Senator Casey represent. So instead of celebrating the holidays, people are worried right now. They're losing peace of mind because they don't know whether they're going to be able to see a doctor or have their children see their doctor. Community health centers serve 25 million people in this country. 7.5 million are children, 300,000 are veterans, which we should be saying thank you to every single day. They shouldn't be standing at the back of any line, nor should they be worrying about losing the health care through community health centers. We know, though, that the numbers aren't enough. This is not about numbers, and frankly, it shouldn't be about politics. It's about people. It's about people and keeping our promises to moms and dads and children that there will be the Children's Health Insurance Program, and to the 25 million people across the country, including 260 sites in Michigan that have community health centers and are serving people every single day. Let me just close by saying that this traditionally has been a bipartisan set of issues, and what's most frustrating to me is that in September, Senator Orrin Hatch, Senator Wyden, myself on Finance Committee, Senator Casey, we worked together. We put together a 5-year extension of children's health insurance, passed it out of committee in September. I thought we were on our way. We only had 1 no vote in the committee. Then Senator Roy Blatt and I put together bipartisan legislation to continue community health centers. 70 members of the Senate have signed a letter supporting this. And yet we can't get the leadership to stop for 1 day and pass something that's bipartisan. Instead, we have divisive issue after divisive issue that's been brought before the Senate when we could get this done. So children, parents, individuals that need health care should not be political pawns in some kind of year-end deal or deals next year. We need to get this done, and that's why we're here. I want to introduce a great champion for children and for health care, Senator Casey. All right. Hello.
Thanks, Mazie, thank you. Good to see you. How are you? Good to see you. We've got an
got
assistant
help.
here.
Yes, yes.
Well, let me say, and I think you can probably hear me.
Yes, this
You
is
can hear me
num-nums.
from a little bit of a distance, but want to say how much we appreciate the leadership Senator Stabenow's provided on this issue, like she has on so many issues, but especially children's health insurance over many, many years, not just in the last couple of weeks and months. Senator Hirono as well has been one of those leaders. This is, I think, a real test for the Republican leadership in Congress, a test for the Republican Party. And it's very simple. They're either going to get the children's health insurance program passed into law or they're not. We're going to continue to advocate, but this is in the hands now of one party. They have an obligation to get this done. I don't want to hear talk about what happened in the past, how bipartisan the children's health insurance program has been. That's nice talk. And when you're talking about the past, it's true. But unless this gets done, all of that work that they claim to have done over many years doesn't mean very much. This is a matter of basic fairness for these families. If you can spend weeks and months as a member of the House Republican Caucus or the Senate Republican Caucus, work night and day to give corporations the kind of tax break they got, depending on what hour it is, it's 1.3 trillion or 1.4, it's fluctuated in that number, but it's well over $1 trillion for the biggest corporations in the world, and they can't even meet the deadline and get over the goal line on children's health insurance. It's totally unacceptable, totally unfair to these families. It makes it worse that this is still not done when we're at the beginning of the holiday season. That puts an exclamation point on the unfairness that we see. So this is very simple. This is a pass or fail test of the Republican leadership. They have control of both houses. They have an administration. I'd like to hear from the president on this. I'd like to hear from his administration urging the Congress to get this done. We've heard almost nothing from the administration on this, and the silence from Republicans on this is deafening. These children deserve to have the peace of mind, and their families deserve to have the peace of mind to know that they're going to have health insurance coverage. For the 9 million nationally, or in a state like Pennsylvania, if you look at it on a monthly basis, it's about 180,000. If you look at it over the course of a year, as many as 340,000 plus children are affected. This is wrong to have this go in to the new year. This needs to get done right now. We need to come together and get it done. But this is really a basic test of the Republican Party. They're either going to be fair to children across the country or they're going to be unfair. I hope they choose the right path. Senator Hirono.
Thank you. Thank you, Senator Stabenow and Senator Casey, for your leadership and your advocacy for children and families all across our country. This is certainly a prime example of misplaced priorities because we can't fund the Children's Health Program that impacts 9 million children. We can't fund the community health centers that provide healthcare services for over 23 million people, and yet, as Senator Casey says, we can spend time, not with our input, by the way, to enrich the richest 1% of the people and corporations in our country, and yet we can't do these things. It has to be more than misplaced priorities. I think the word misplaced is not strong enough. So here we are saying, why don't we get this done? We could have gotten this done way before these programs expired. So let me talk about in Hawaii. Nearly 30,000 Hawaii's keiki, and that's children, depend on CHIP to stay healthy. And more than 6,000 of them have complex medical conditions. So their families right now are worrying, how am I going to take care of my child who has complex like diabetes or whatever the ongoing medical condition is. They're just worried sick. Hawaii's federal funding will run out as soon as February. And at that time, the state of Hawaii will have to make up for that shortfall. I have visited many of Hawaii's community health centers and know firsthand how important this funding is. An example, the community clinic of Maui expanded prenatal care. So that means that the pregnant mothers no longer have to fly to Oahu. See, those of you who haven't visited Hawaii, we're made up of islands, and if you're on Maui, you're not on Oahu. So to have this clinic expand their prenatal services means that these mothers do not have to fly all the way to Oahu. Or Kalihi Palama Health Center on Oahu built a new dental clinic and medical exam rooms to serve infants and children. Now, Kalihi Palama is in an economically challenged neighborhood. And so, these are a lot of kids who otherwise would not get the kind of dental care and medical care that they need. On the Big Island, there's a clinic called Bay Clinic, and they bought their first ultrasound machine and established a mobile clinic to reach families who couldn't travel to Hilo, which is on the, it's on the same island, but it's still a long way to go for them. So this is something so clearly what needs to happen that, we have to ask ourselves, why the heck are the Republicans holding this up while they are on some sort of, I don't know what to call it, like they're on a mission to enrich the richest people and corporations in our country. So, you know what, it will take all of us to raise our voices because healthcare is personal, as we saw when the Affordable Care Act was about to be repealed. And in fact, this huge tax bill, by getting rid of the individual mandate, is in effect a repeal of the Affordable Care Act. And so, in their push to get this tax bill passed, I hope that they will find out how terrible this bill is for middle-class families in our country.
Thank you, Senator Hirono and Senator Casey. And now we want to hear from two special people that are going to share their story today. The first is Kymberly Renee Grafton, among other things, and I will let her share her story. She's a veteran of the United States Naval Reserves from 2002 to 2009. Kymberly, we are very grateful for your service to our country, and we are standing with you to make sure that you're getting the health care that you need. Well, hello, and somebody else is standing with you, too. Yes.
Good afternoon, ladies and gentlemen, and thank you for allowing me to share my story today. My name is Kymberly R. Grafton, a native Washingtonian, graduated from the District of Columbia Public School System. I'm a veteran of the United States Naval Reserves and a patient at Unity Healthcare Center since 2014. Previously, I was a case manager for the special needs population in D.C. and the surrounding county areas, and caretaker for my mother and her parents before they passed. In 2012, I was in a car accident, and given my debilitating back pain, I was unable to work. Today, I still have trouble walking, sitting, or standing for long periods of time. After my surgeries, I started going to Unity for primary health care, dental, and behavioral health services in the Anacostia area, which is like half a block from my home. At Unity, I received thorough health care, where health care is a partnership between the patients and the medical personnel. However, I'm still adjusting to many life challenges I've been through over the past 9 years. This led me to seek mental health services at Unity as well. My providers at Unity really care about their patients. I am taken seriously, and I feel important to them. After starting to work with them, I'm better able to handle my emotions, and they're able to help me to be more active and involved in my community, such as volunteering at this year's Safeways Feast of Sharing. And now I'm looking towards the future. I'm working on obtaining my social work license and hope to be a grief therapist. Community health care centers are vital resources that need to stay open. I don't know where I would be if Unity was not in my community. Thank you.
Thank you so much. Yes. Senator Casey. Yes.
I have the pleasure to introduce a constituent of mine from Pittsburgh, Connie Cavara. Connie is a mother of 3, Connie's a nurse who lives in Pittsburgh. Two of her 3 children are on CHIP, and a third receives his care as a result of the Medicaid program. So Connie, we're grateful you're here and grateful you didn't come alone.
Join us. Please.
Hi, good afternoon. Thank you to Senator Stabenow for inviting me here and for Moms Rising. I'm here to share my story. I want to thank Moms Rising for convincing me that my voice matters and for fighting tirelessly for our children's health. Thank you, Senator Stabenow, for that passionate speech yesterday, too. My name is Connie Cavara. I'm a nurse from Pittsburgh, Pennsylvania. I'm a single mom of 3 children, as Senator Casey mentioned. I have Carmen and Diego here with me today. I'm fortunate enough to work in a good job that offers benefits. My employer-sponsored health insurance is high quality and affordable, but only for me. If I wanted to add my children to my plan, I'd have to pay an additional $900 a month. After taxes, that's an entire paycheck for me, before copays and deductibles, and I simply cannot afford that. Thankfully, Carmen and Diego are covered under CHIP. CHIP has been a lifesaver for me and my family. With CHIP, I know that I can afford regular routine health care for my kids, and if a medical emergency arises, it wouldn't send us into bankruptcy. CHIP has already seen our family through some trying times. When I was pregnant with Carmen, doctors noticed a mass on her adrenal gland that was evident in an ultrasound while I was still pregnant. Carmen needed extensive testing that began the day she was born, and to find out if it was cancer and what care and treatment she would need. Thankfully, it wasn't cancer, but we needed that testing to know. Without CHIP, the medical expenses from all her testing would have buried us, limiting our family's prospects for years to come. Fortunately, the mass was benign, and after CHIP covered the costs of her medical procedures, Carmen was able to get the healthy start in life that she and other children deserve. Our family is lucky. We don't have major health problems, or we don't require expensive medications, and I do have a stable job. Still, no one can predict the future, and without insurance, I don't know how we'd recover financially from a medical emergency. CHIP is the only way many working families like me can afford quality health care for our kids. As a nurse, I spend every day taking care of other people's family members. Without CHIP, I would not be able to take care of my own. I'd like to thank the senators for inviting me, Senators Stabenow, Casey, and Hirono, for urging the Republican Congress to extend CHIP funding. Members of Congress need to come together immediately to renew funding for this invaluable program. Whatever our political differences, I think we can all agree that nothing is more important than the health of our children. Thank you.
Thank you so much.
Thank you.
That was great. Thank
Thanks.
you. Well, thank you so much to our guests, and we'll be happy to take a couple of questions. So there's questions, or we may want to hear from somebody else. I don't know. Yes, sir.
I wanted to check and see, would you vote against the December 22nd continuing resolution if it does not include long-term, multi-year funding for CHIP?
Well, we're in the process of negotiating right now, and it's not going to be helpful at this point to set bright lines in the sand. And this is a top priority for me, for our whole caucus, no question about that. But I think in the middle of negotiations, it's best not to get into all the discussions that are going on.
Are you trying to add like a multi-year funding for CHIP
Absolutely.
in the talks?
Absolutely. I mean, we will move it forward as quickly and in whatever way we can. Whatever bill is moving, we would love to see it attached. And let me emphasize again that it would only take a day on the floor. Certainly, I think our kids deserve a day on the Senate floor where we could get this done. Yes.
What's your thinking about the offsets that have been offered for the bill that's already been passed in the House?
I don't support the offsets, and we yeah, think there's a better way to do this, and that's part of the negotiation, but I don't support what the House did.
What would the better way be?
Well, we're in the middle of negotiating that, so.
Would you be okay with a short-term funding for CHIP, like funding that would stretch it into January when another CR is brought up?
Well, again, this is all part of the negotiation. Traditionally, this has been 5 years. Now, we did it for 2 years this last time because we couldn't get a 5-year commitment. But families need the peace of mind. It doesn't help when you say, instead of before Christmas, you're losing your health care, it'll be in the new year. That's not fair to people. We have a commitment for a long-term solution. It is bipartisan. It's just about whether or not the Republican leadership thinks it's a priority to get it done. And please step in if you.
Let me just add one
Yes,
thing to
Bob,
that.
yes.
If the Republicans can work so hard and come to a consensus within their own party on permanent tax cuts for corporations, I think they can at least get 5 years for kids. And that has happened more than once in the past. That should be a pretty easy assignment in light of what they've done for corporations.
Good point. Good point. Yes, we'll take one more. Yes. Well, again, it really is a question as to what will have pay-fors and what will not, and so that's a broader, a broader negotiation that's going on, and I would suggest again, to piggyback on what Senator Casey said, to do the partisan tax bill that is predominantly for the wealthiest Americans. They're willing to create a $1.5 trillion deficit. And so from our perspective, including help for children, the Children's Health Insurance Program, and community health centers that provide health care for 25 million people is as least as important as that, more important. Thank you very much.
Yep, great
Hey.
job. Great job.
Thank you, thank you, thank you, thank you.
Amazing
Thank
things.
you,
Thank
so we will be, and thank you for coming. Connie, you were great.